welcome to the office.
Gabriel, welcome to the office.
Perfect. I'm glad to be here.
Nice to meet you.
Nice to meet you as well.
How can I help you?
Suffering from low back issues.
Okay.
It's been for about 15 years. Gets to a point where...
What happened 15 years ago?
It's a combination of a lot of things. It's a combination of sports. I've wrestled for quite a while, coached for quite a while, active coach at that time.
Okay. Wrestling coach.
Wrestling coach.
Cool.
Jiu-jitsu as well. And during that stint of 15 years ago, I was really into heavy lifting, heavy deadlifting and whatnot.
Okay.
And the moment where I noticed my back actually started to give me problems was doing a heavy deadlifting program. I wasn't really wearing belts that much at that time, and felt fine during my lifts. Went home, cooled down, went down to pick up a toy from my son, and I couldn't get back up.
Isn't that crazy?
Yeah, it's
you know, and it's like people will say, "I just went to pick up a toy."
Yeah.
Obviously, there was a process going on.
Yes.
That was developed. Okay.
Yeah.
And that was 15 years ago.
15 years ago, yeah.
Okay. So what did you do for it?
I've been in and out of physical therapy. I've seen other chiropractors in the past, and been through massage therapy.
But for what? What's going on?
Never really got a full answer on why the specific area was giving me the issue.
Is it the sacrum? Is it the pelvis? Is it L5?
Never got that,
is it this? Is it that?
Yeah, never got that until I did go to my primary care a few years ago. They did an MRI. They did show there was some herniation in L1 and also L4, L5.
Okay.
And a little bit of degeneration as well.
Sure. Okay.
That was over the years. But yeah, a lot of the times it was more of maybe trigger points that was causing the issue.
And you're still dealing with this?
Still dealing with it, yeah.
So from 15 years ago, fast forward, it's the same, it's better, it's worse?
It's worse.
Because you're here.
Yeah.
And so it's obviously
it's worse.
bothering
It's like an everyday thing.
Okay.
Yeah, there's always a constant, either a stab or just a sensation on my back. That
How old is your boy?
I have a few boys, but the oldest now is 15. I have a 13-year-old, and it just goes down the list. I have 6 boys.
Oh, wow,
yeah,
nice.
6 boys.
Congratulations.
Yeah. Thank you.
Done.
Easy work for me.
All right. So what are you doing for it now?
Now is consisting a lot more of stretching, focusing a lot on trying to the mobility as much as I can.
Okay.
But then I do get hiccups. I would say about a month ago, along with my workout routine of weightlifting lighter than I've been doing. I was just stretching and I moved, and then it just took me out for 2 days where I wasn't able to get out of bed.
Oh, wow. Okay.
That's kind of where we've been. There's days where it feels amazing. And then once something happens, like
every month, every couple months?
It seems to be maybe every month. It could be every 2 to 3 months or something.
But it just seems more frequent now.
Yes.
Okay.
Yes.
Fair enough. And all right, out of all the treatment you've done, what helped it the most?
I did get some injections. This was, I would say, maybe 2 months ago, 3 months ago. It was along the SI joints.
Okay.
It was I forget what it was called, but it was some sort of gas that they injected in there for an irritant in order to, I guess, a controlled inflammation and I guess in a controlled acute process.
And that helped?
It did help. It did help for a little while, and then it started to kind of go back with
Band-Aid.
Yeah.
Okay. All right. What else?
Besides that, I mean, that's the main concern.
Okay.
Main issue.
Whatever else I find along the way.
There's really not much that anybody else has really said. Other chiropractors have just kind of given me the same thing. Nothing against them. They definitely helped with decompression. That seems to have actually kind of helped a little bit.
Okay.
But yeah, there really wasn't a specific answer on what's going on.
All right. So let's see if we can give you some answers today.
Perfect.
Okay. Have you ever had a full spine X-ray?
No.
So people wonder why are you wearing a hospital gown?
Right? Yeah, she liked the color on me. So.
Everyone asks that, and we like to gown all our patients, so when we're doing the exam, we can see everything clearly.
Okay.
And then we do the full spine X-ray. Why? So we can see the whole picture of the patient.
Okay.
And so why don't we go over your X-rays?
Sounds
and as I'm going over it, you have any questions, you ask. If you're uncomfortable with anything I'm doing, just tell me to stop. Okay. Just communicate.
Okay.
And you got your back up here, so I think you should be okay. Come on, slide over here. All right, Gabriel, this is you. This is a picture in time. Tells us how you've evolved from birth. Okay. We have 24 bones in the spine that move. We have 23 discs in between. Think of this as your 24-story building. This is looking at you from the back. This is the right side here, and I'm going to just label at the bottom. This is your side profile, okay? And on the side profile, we're looking at three main things. We're looking at curvature in the spine. We're looking at posture, and we're going to look at the disc spaces. We'll come back to this, though, because we're going to get a couple of answers here right off the bat that I don't know if you were told or not. I want to make sure. Okay. So when we're looking at this, and you've been following for a while, I think you've watched me explain x-rays in detail. Yes. Now, in your scenario, what do we see here? So we said this is your 24-story building. In order to have a stable building, we need a level base and foundation. Do we have a level base and foundation? No, we do not. We actually have a 13 millimeter lowered leg or measured difference. And in this work, the way we look at it, Dr. Gonstead found this needs to be under 7 millimeters for adjustments to hold. Okay. Yeah? 13 millimeter measured difference. Now, there's a misalignment of the pelvis and there's a drop of the sacrum on the left side. There's no rotation of the sacrum, so that's good. When we're looking at the pelvis, correction of the pelvis will raise it up 1 millimeter. 4 millimeters is coming from that tailbone. So there's still a little discrepancy. A heel lift may be indicated, and that may be the answer to everything holding. We'll see how you do with a couple of adjustments, and then we'll decide if we're going to add that in or not. Okay? All right, so now we see ASEX. What does that mean? It means that there was definitely a fall trauma, but we already know you play hard. I'm sure you work hard too, but you play hard. ASEX, what does that mean? The left pelvis, we're referencing the PSI as this joint, this bone to the sacrum. Yours has gone up and out. Typically, the way the SI joint works, it's called a auricular surface. It's a tongue and groove. And when it goes AS, it naturally wants to ride in IN. When it goes down PI, it naturally wants to come out EX. So if we see ASEX, then we know this was from a trauma. This wasn't from posture or something. Okay? So the first answer is you have the short leg or lowered leg on the left that needs to get up under 7 millimeters. So at 13, we need to figure out how to get that up under 7. Otherwise, adjustments won't hold, and that's why your things weren't holding. Okay? That's your first answer. The second thing is we have the drop sacrum. So that's probably where we need to start in the tailbone. Now, I'm going to switch over to the other x-ray for a second. And first thing we want to see is the low back. There's your L5 disc right there. 4 is, you can see the circles, right? That's from the kink in the spine, or the tilting on the spine, right? That's from the short leg. But where we actually need to start, which is kind of hiding out down here, is down in the coccyx. And you have a slight anterior coccyx. And it all started down there. Okay, why is that important? Between the short leg and the anterior coccyx, nothing holds because the foundation of the building is not stable. Not stable, right. Okay, so first thing, coccyx may be 1 or 2 adjustments at that in your case, okay? It's a little open wedge in the back. The good news is, and with as hard as you played, your tailbone overall looks pretty good. I'm happy with it, overall. So we need to deal with this one, and then in terms of sacrum, we're probably looking at bringing the, based on what we find, S1, S2, S3, we're probably going to find it at the 3rd sacral segment in your tailbone, and that's the one we need to get up. Okay. Now from there you can see these are compensating. It comes back to level here. So 5, 4, 3, 2. These are all compensation. That's not your issue. We don't need to mess with those. Okay, I'm going to come back to this a little bit later. Clear on that, though? Clear on that? Yes. So from the foundation, what do we see? From the short leg, it's causing the slight curvature to the left side. Yes? Yes. Okay. And that curvature to the left then does what? It's not going to go all the way over here. It's going to come back to neutral about here. Then it goes up. Then we got another kink going to that side. And this is the issue if you have any neck issues or not. You have a T2 side slip. There was a good hit from that right to left side. And that's throwing the neck off.
Okay.
a little bit, okay? You can see it comes like this now, and then curves. And that's something we may want to address. I know you didn't complain of any neck issues or any upper back stuff, but again, from the work that I do, I'm looking for nerve pressure. If there's pressure there, we'll deal with it.
Right.
But I know at some point we're going to need to deal with that, or we're going to have neck issues later on.
Okay.
Okay? It's just what it is. All right. Questions so far?
No, sir.
Digestion. So when we're looking at digestion, first thing we want to see is the Megan-Blasi, the gastric air bubble. Yours is kind of absent. So maybe it's that right there. We want to see a big black half circle here. That's number one. Number two, we're looking, this is the ascending colon. And we're getting a lot of undigested food in the colon, producing a little gas. He produces a lot of gas, huh?
Surprisingly, he doesn't.
Oh, he doesn't?
Yeah.
Not at home? You don't have gas?
Not that much.
Okay.
But I'm not very common either when I go, so that's the thing too.
Say that one more time.
Not very common to go to the restroom. It's like maybe sometimes it's once a day or once every other day type situation.
So there's no consistency.
No
in that?
consistency. No.
Okay. So it's something we want to look at also in terms of potential HCl need. We'll see how a couple of adjustments do.
Okay.
If you watched, I talk a lot about digestion and HCl, and after 40, 35, we should, we all lose the ability to make HCl, so it becomes important. If we're not eating super clean or we're eating a lot of meat, then you may want to think about supplementing with HCl.
Okay.
Okay? Upper cervically, if we're looking at the capsules here, and you don't get any crackling in your neck, do you, up top?
Not that often, no.
Okay. So the only thing I'm looking at here in terms of the atlas, the capsules or the disc is a little bit less than normal, but I think if we're getting good motion in the lower part of the body, it's going to affect a lot of your upper body too.
Okay.
All right. Now, let's go back here and let's talk about curve. So the first thing you should see, we need a 60-degree forward curve here, 60 in the back, 60 in the neck, 40 to 60 in the neck. There's no curve in here, right?
Yeah.
And so the shorter leg or the lower leg and no curve, there's no shock absorbing mechanism. Our first line of defense against the forces of gravity is our 60-degree reciprocating curves. This is our first line of defense. So when we have compression with those curves, that absorbs a lot of the pressure. When we have a straight spine, what's taking up all the slack? Something in the middle, but more importantly is the lowest lumbar. And that's, I think, part of the
What's
issue.
going on, right?
So we got to figure out how to bring that leg up and help you get that curve back.
Okay.
And part of getting that curve back is actually the AS pelvis. There's a few things I'll need you to do. You working most of the day?
Yes.
You're out of the house most of the day?
Most of the day,
Are
yeah.
you on your feet or are you on
On my feet.
You're
on
on
my feet most of the day, yeah.
Okay. All right, so I'll give you the homework you can do at home then.
Okay.
Okay, no problem. Now, let's look at, we said the disc spaces. The disc is still good. Okay, those are curved. We said they're compensating. As we go up, the discs, we can see them. They're good. I can still see this one and this one. These discs are fine, but then what happened over here? 2, 3, 4, 5, C5. Something happened at C5. So you can see that disc is level, and then that juts back.
Right.
And it's not that you're leaning back on it, it's because even leaning back, what is it doing? Something happened here. So 2, 3, 4, 5. C5 kicks back, 4 goes with it, 3 and 2 start to level off though, do you see?
Yeah.
I'm looking at the discs.
Yeah.
So we have a potential at this C5, C6. We have the sacrum, pelvis, and T2. Those are the majors that I'm seeing on the x-ray.
Okay.
Does that make sense?
Yes, sir.
Any questions on that?
No.
Okay. Ma'am, does that make sense?
It does.
Yeah, right? Okay. All right. You ready?
I'm ready.
Good. Let's go over there. So let's start by running the meter on your back.
Okay.
Starting at the base of the neck. Head down, please. And the first thing we're getting is actually 15 points, dude. 20 points. C5, C6. Left side. C1, 10 points. Right side. T67, 10 points, left side. Actually, no, watch. Comes, it doesn't stop until there. So that was misleading. It looked like it was going to break there, but it didn't. It kept going, and it breaks there. More at T9, T10 area. T10, maybe T11. Let's check down low. That's down in the tailbone, dude. There it is. S5 coccyx, 10 points. S5 coccyx, T11 area, C5, C6. Those are the three majors that I'm getting today. Feet together. Scoot forward a little bit. Open and close your knees with your feet touching. Open and close. Good. Right side only. So we're checking general motion as side joint. When he does the right side, left moves a tiny bit with it. Left side only. I mean, they both move. They're both kind of stuck. You had injection in both sides, you said?
Yes, sir.
Okay, scoot back a tiny bit. That means we got to do this safe. Come back slowly towards me. That's 5. Tender.
Mm-hmm.
That's 1. More tender.
Yeah.
2. More.
All tender, yeah.
3.
Not too tender.
4.
No.
5.
No.
And this is where I'm getting
Oh,
it.
yeah.
Down the tailbone.
Yeah.
So that's where we're going to start, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 11 or 12. 11.
11.
Now let's do static palpation for a second. Head down, please. Static palpation, running my fingers down the spine. He's generally inflamed. 6 boys?
6 boys, yes, sir.
Damn. Good for you. 7, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That one?
Yeah.
Or that one?
The right there.
That
yeah.
one.
Mm-hmm.
1. It's actually T12. T12, S5 coccyx, and let's check up top. Sit back for me, please. So let's check general motion. Got to grab a little hair, okay?
Mm-hmm.
7, 6. That's the one right there. Left side there, C5. Stand up for me, please. Right over here. Walk to the corner of the room and back a couple of times, please. Just keep going. The dimples actually don't move too, but the dimples are all right. The right one is a little more stuck than the left, but they still move. So that's good news.
That's good.
The left moves up and down fine. The right one gets stuck a little bit when it goes up. Keep going. But overall, not bad. Okay. All right. Cool. Have a seat. Let's get a game plan. We're going to have fun today.
That's what I'm here for.
That's what you're here for.
Here for a party.
So here's the plan. C5, T12,
Okay.
and we're going to start in the tailbone.
Okay.
Okay, so we're going to start over here, tailbone first. Actually, you know what? Yeah, let's start over here. Tailbone and T12 here. Have you walk. See how you do.
Mm-hmm.
If we need to do more, we'll figure out which table, and then I'll end with the neck.
Okay.
After the spine adjustment, have you walk, and then we'll do the extremities for you.
Okay.
Okay?
All right.
You ready?
Let's get it.
Let's do it. So we're going to go face down over here, please. And I'm on the underwear, okay, sir?
Yes, sir.
Right on the... And let's use the drop. There you go. Then we want to lift it over and through. I to S. That's a piece. Normal breathing, okay? There you go. Gotcha. Let him go. That's it. That's it. Now, let's do 12, 2. You okay there?
Yes, sir.
That's a piece. We're going to do that on the knee chest table. Wait for it. Step away from the vehicle. Let's walk that off, please. Cool.
Oh, wow. Yeah, the right leg usually feels like I'm swinging it over, but it feels pretty nice right now. It's pretty clean.
One thing you're going to need temporarily is a donut pillow because of the coccyx adjustment.
Okay.
So you want a pillow with a hole or use a towel or something, please.
Okay.
Cool. Drop that belly button down, please. Drop it down. There it is. Gotcha. That's the home run, baby. Come on up when you're ready, please.
I've been waiting for that.
That's a good one.
That's awesome.
Okay, I'll have you go that way and I'll move the table.
Okay. I've been needing that.
Good stuff, guys. Walk it out.
Jeez.
That's the chi. That's the qua.
That's the qua.
That's the qua.
Now, is there a thoracic that is responsible for the heart?
Yeah, T1 through T4.
T1 through T4.
You know that side slip I told you about up top?
Yes, because I do get heart palpitations that just happen randomly, and I've been to
Palpitation is usually upper cervical.
Okay. Yeah.
Usually.
Cardiologists, everything's fine on their end, and
Okay. Well, we'll check it out.
yeah.
We did T12. We did Coccyx. Now let's go ahead and rescope and see what shifted. All right. Head down, please. Starting at the base. Hmm. 12 is clear. It's night and day, dude. Tailbone is clear. I'm getting 4, 5 showing up, T4, T5. That's so crazy. That cleared his neck, but T4, 5 showed up. Interesting. Let's take a look. Head down, please. 7. 1, 2, 3, right there. You feel that one more? Or 5?
Oh, 5.
6 or 5?
5.
5. Let's go down on the, we can do this. Let's go back here
on the table.
5 is where is under those 1 through 4. 5 is more liver, gallbladder.
Okay.
Okay, more digestion. T5. Nice. A little more. Drop the shoulder. He's fighting. Drop the shoulders, hands. Drop the hands down.
Oh.
Yeah. He was doing this, so he was tensing up. Gotcha. Nice.
Walk it.
Walk it out. Nice. Now, as you're walking, tell me if anything is different.
It all feels different. I feel lighter. I feel like I can breathe better.
Okay. You're not wrestling this week, right?
No, I actually haven't done it. That's one of the things I've stopped doing was jiu-jitsu and coaching as well a few months back. So
Right now, just walks, okay, please?
Okay.
No heavy weights, any of that.
Okay.
Just walks, cardio, swimming, elliptical with handles, just for a few adjustments.
Okay.
Have a seat, please. Let's continue. I'm sure we're going to have to get to this neck at some point, but pressure-wise, it cleared up, dude.
Awesome.
Clear. That's cool. Ah. 12 is clear. Tailbone is clear. You remember what this felt like?
Yes.
Come on back. Check it out.
Yeah.
1, 2.
Good.
3. I didn't touch any of these.
No.
4.
Yeah.
This is the one I did.
Yeah, it feels a lot better than I did, yeah. Yeah.
Yeah. On your back, please, here. Let's work on your feet. Right leg
I'm
up.
sorry.
AS talus. Raise your left leg up, please. There you go. Sit up and turn. Just do the shoulders. I'll be reaching over, okay?
Okay.
No jiu-jitsu on me. Slide over to the right. I used to take care of a bunch of cops, man, and then 2 of them almost decked me from a reflex. Seriously, man. That's all. Left side. That was my finger. Oh, yeah. Okay. Next, let's do buff and polish on the back. Vibration therapy.
Okay.
I'm a big fan of vibration, dude, therapy. You do body work, you do this first, makes your body work easier.
Okay. And what's the difference of this and like the percussion?
Well, that's percussion, this is vibration.
Difference with
That's
the-
more the
Got it, yeah.
meat tenderizer.
Right.
This is more breaking up adhesions and more at the fascial level.
Oh, nice. Okay.
More feel the difference,
Yeah,
right? Some
huge
areas
difference.
are spicier than others, but
Yeah.
lots of ice, donut pillow, and
Okay.
then Sakina will give you a bunch of homework. Not a bunch, but a little bit of homework to do. All right, walk it off last time, and let's check those hands.
All right.
Questions for me?
No, you said donut pillow. And
So
something
the
good
main
there.
thing with you is movement and the
move.
donut pillow. And she'll go over in the email yoga ball, have a yoga ball at the
Okay.
house, sit on it, and you're going to bounce on it, 5-10 minutes every morning, 5-10 minutes every night.
Okay.
That's going to get great mobility in your spine,
Okay.
okay?
All right.
You can still get back to wrestling down the road if you want.
Okay. Yeah, that'd be
If
nice.
you want. If
Yeah.
you want.
Yeah.
But right now, you got to give your body a couple months to heal.
Yeah, I
Doesn't
think
mean you're
that's-
getting adjusted all the time, but you need to heal.
Yeah. That's
Right?
my problem. I don't let myself heal.
So that's up to you. You got to help them out then. It's not about, you don't want to work out an imbalance. This is the big thing I tell people, right?
Right.
Get in balance first, and along the way, do your body. If you want to do some body weight, it's fine. Come stand over here, please. If you want to do body weight, pull-ups, push-ups, planks, that stuff, I'm okay with that.
Okay.
Okay? Squeeze slowly. Good. Slowly. Elbow.
Ooh,
Lunate.
that's there.
Almost. Nope.
There it is.
Scaffold. Squeeze. Squeeze. Hold on the inside. Let it go. Radial head. Distal radius. Lunate. Scaphoid. Squeeze slowly. Awesome. Squeeze. That's where we're going to start.
Fantastic.
Questions?
No questions. Thank you
Besides
so
that?
much. Yeah. Thank you.
Welcome to the office.
Thank you so much.
You got it, brother.